Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. Antigua Barbuda sees itself as a possible exporter of medical services and prepares. This story takes the lead in our 1039th edition of Caribbean Perspective for Friday 29th January 2021. Details after this break.
Did you know that your friends and family can now shop at the Food Fair from anywhere in the world and you can receive here in Grenada? The Food Fair and GrenadaMarket.com now make it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
Welcome back. Ground was broken on Tuesday for the construction of the state-of-the-art Medical Doctors Hospital and Medical Complex at the City Park Development Woods Estates in Antigua. The facility anticipates to open in 2 years. It is the brainchild of renowned surgeon Dr. Joseph John. Prime Minister Gaston Brown told the gathering his government is desirous of driving the export of medical services. ABS's reporter Cherilyn Beezer was there and filed this report.
To establish Antigua Barbuda as a significant medical center within the Caribbean that could export medical services to the rest of the region.
The nation's leader is also encouraging others to follow Dr. John's lead.
Because in order to establish a vibrant healthcare export service industry here in Antigua and Barbuda, we need more private practitioners. And that is where the other physicians could team up with other family members who are physicians or friends to establish these medical centers.
These centers, he says, would specialize in certain areas so that they can export medical services. Employment opportunities would also be provided for other practitioners. The Prime Minister says the export of medical services is an important area which could diversify the country's economy.
You know, for example, that we now have RIAT literally as a national airline. And in terms of moving people, I'm quite sure that our capacity to move people into Antigua and Barbuda to be treated is something that we will have as a competitive edge compared to other countries, certainly within the Northern Caribbean region.
The nation's leader says it's an area he'd like to identify for future investments and commits his government's support.
To incentivize those investments, to provide land at a concessional rate where appropriate, and certainly to provide the concessions on all of the building material, equipment, fixtures, fittings, everything.
Cherilyn Beezer reporting for ABS News.
While revealing that he is in receipt of information that suggests that government ministers are demanding the COVID-19 test results of staff members under their purview, leader of Guyana's opposition Joseph Harman has lambasted the incumbent administration for its ineptitude in dealing with COVID-19. HGP's Wendell Badri reports.
Leader of the opposition Joseph Harman, during a virtual press conference on Tuesday, has condemned the PPP administration for its lax approach to combating the COVID-19 pandemic, even while a new strain of the virus has been identified.
There's an explosion of COVID-19 cases in Guyana, with over 7,000 confirmed cases and 170 deaths, as is up to yesterday. And with the PPP, of course, regime appearing inept in managing the spread of this pandemic.
On the heels of the new strain of the virus, the opposition leader posited that the country's borders remain open to inbound passengers, even from countries where the new strain has been confirmed.
Guyana's borders, as you know, remain open, and there's a daily free flow of persons from several countries where this new strain of the virus is prevalent. The measures that have been instituted at the Chalijagan International Airport for incoming passengers are at best lax and casual and puts the entire Guyanese population at greater risk.
Harman also revealed that his office is in receipt of information that several ministries have had outbreaks of the virus and that some ministers are demanding test results for staff members should not go to them directly, but should be handed over to their respective ministry.
We call on all government offices where there is an outbreak of COVID-19 to implement the COVID-19 protocols and that the premises be thoroughly sanitized so that the lives of our workers can be protected.
On the heels of that revelation, Harman called on Guyanese to protect themselves by following the stipulated guidelines. Those are washing and sanitizing their hands, wearing masks, as well as maintaining social distance. Meanwhile, on December 22, 2020, during the course of the daily COVID-19 update, Health Minister Dr. Frank Anthony said that Guyana is awaiting advice from the Caribbean Public Health Agency, CARPHA, as to how it should proceed with regard to travel bans to restrict the spread of the virus to these shores.
So we'll await some further guidance from CARPHA, and they have been talking to their virologists as well as virologists from PAHO. So once we confirm some of the mutations and understand the impact that these mutations might have, then we'll be able to make a more definitive pronouncement.
Early January, there had been a closure of the border between Brazil and Ghana, with limited commodities being allowed into the country. When this newscast reached out to the Ghana Civil Aviation Authority to inquire whether travel has been restricted into the country, a member of staff responded in the negative and further stated that persons traveling to the country are required to test for the virus 3 days prior to traveling. As of Monday, January 25th, Ghana has recorded 7,317 positive cases of the virus with 172 deaths. 6,431 persons have recovered as of Monday. Wendell Badri, HGP Nightly News.
As Guyana's High Court prepares to move along with the election petition case, the Chief Election Officer Keith Lowenfield on Wednesday handed over the statements of poll and statements of recount to the Registrar of the Court. Gordon Mosley of News Source Guyana reports.
The move comes under order of the Chief Justice Roxanne George, who is presiding over the election petition matter. The attorneys for Vice President Barrett Jagdeo had requested that the court takes possession of the statements, as it was nearing the date for them to be destroyed in keeping with the law. At the courthouse today, Mr. Lowenfield spent several hours as he handed over the documents and verified all that was being handed over. He said the Ghana Elections Commission Secretariat has made copies of all of the documents handed over for its own record keeping.
The law is very clear as to the duration that the CEO is to hold these records. It's very clear. However, if the Chief Justice has ruled, then the CEO has to acquiesce to the ruling of the Chief Justice.
Are you keeping copies for yourself or the Secretary? Well,
obviously, I won't give away all that I have. So that is what we're doing. We're pushing to conclude the exercise today. We've already completed all the statements for the general elections. We are currently working on the regional, and as soon as we conclude that, we'll move toward the SORs.
The Chief Election Officer also said that all of the statements of poll and statements of recount for both the general and regional elections were handed over. The chairman of the Elections Commission, Justice Claudette Singh, was also present for the handing over of the election documents. The election petition case is seeking a number of orders from the courts and declarations, including matters related to the lawful conduct of the elections, the recount of the votes, the results of the elections, and the allocation of seats in the National Assembly.
You're listening to Caribbean Perspective with Eddie Frederick.
In St. Lucia, the question is asked, did the authorities there drop the ball during the holiday season? And a former politician dismisses student groups pushing virtual learning as opposition mouthpieces. Colby DeVoe of HTS News Force reports.
Some argue that the government should have implemented more stringent measures over the holidays given an anticipation in an increase in home quarantine applications and tourism arrivals. St. Lucia has witnessed a staggering post-Christmas season rise in COVID-19 cases. Other countries in the region have also recorded sharp increases over the past few weeks. The executive director of CARFA, Dr. Joy St. John, recently stated that this may be the result of complacency in territories to get the tourism sector up and running. Local authorities attribute the spike to a lack of public compliance with protocols. However, some critics argue the authorities are equally to blame. So, did the state drop the ball? Chief Medical Officer Dr. Sharon Belmar-George says it's not so much the protocols but the failure to adhere to them.
The biggest problem we saw during December was not the change in the policies because they were still restrictive. They still allowed very small groups. There are certain things that we stopped to reduce the crowding, like the fireworks, etc. We canceled all staff parties and all activities. We stopped a lot of the social activities associated with the season. But what we noted, which put us at great risk during the month of December, was the non-adherence to home quarantine and the non-adherence to these very same policies.
Dr. George says health officials use epidemiological analysis to amend COVID-19 protocols.
What we use is the data coming out in terms of the rate of increase of cases, and that is a discussion that happens at the level of the command center. This is then taken to the wider NEMAC grouping, which includes a wide cross-section of services across society. During December, we noted a reduction of the rate of increase of cases, and in discussion with the wider team, a decision was made to relax some of the measures.
The Health Ministry is experiencing a backlog in PCR test results due to a high rate of infections. PCR evaluation is currently facilitated by the Ezra Long Laboratory. The Chief Medical Officer says private labs will be allowed to conduct antigen testing for persons departing the country to help ease the burden on the state lab.
One of the decisions that has been made to relieve the load on our Ezra Long lab is the exit testing. A decision has been made that the exit testing, because at least 2 developed countries accept antigen testing. So this, a decision has been taken that the private labs will be allowed to do that for persons for exit travel.
The number of infections shows no signs of easing up as the island's case count nears the 1,000 mark. The island broke its daily record for reported cases over the weekend with 76 new cases on Sunday, January 24th, 2021. On Tuesday, health officials also confirmed another 48 cases, bringing the total number of cases diagnosed in country as of January 26th, 2021 to 969. Colby DeVoe, HTS News Force.
A 48-year-old woman who had an underlying illness is the 11th person to die from COVID-19 in Barbados. The Ministry of Health and Wellness, and by extension, the Government of Barbados, extends sincere condolences to the family and friends of the deceased. It is the 4th death from the viral illness over the last 9 days. The 761 tests carried out by the Best Dose Santos Public Health Laboratory on Tuesday also identified 16 new COVID-19 positive cases, while 22 people recovered from the viral illness and were discharged from isolation. As a result, there are now 353 active cases on the island. The 11 new positive comprise 14 Barbadians and one whose nationality is still to be determined. One of the new cases is someone who was previously sent to the Harrison's Point Isolation Facility in St. Lucie for assessment. The number of cases at Her Majesty's Prisons, Dodds, remains at 361, consisting of 102 staff members and 259 male inmates. To date, Barbados has recorded 1,443 confirmed cases, 580 females, 863 male, and 1,079 people have recovered. The Public Health Laboratory has so far completed 100,890 tests.
Did you know that your friends and family can now shop at the Food Fair from anywhere in the world, and you can receive here in Grenada? The Food Fair and GrenadaMarket.com now makes it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket, and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
I am Eddie Frederick, wishing you a restful weekend. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.